Welcome to our Mary Greeley Primetime Alive program, Population Health, helping you get more out of your Medicare wellness visit. I'm Vicki Newell with the Mary Greeley Primetime Alive program. As a reminder, if you want more information about Primetime Alive, to sign up for a program or to learn about our benefits, you can go to mgmc.org/PTA. Our presenter today is Rachel Breifogel. Rachel is the manager of population health management at McFarland Clinic. She's been in healthcare for over 30 years. Her nursing adventure started in high school when she worked as a CNA in a nursing home in her hometown. She then went on to Luther College, where she received her Bachelor of Arts in Nursing. And after graduating, she moved to Des Moines and worked at Mercy One and Unity Point on their cardiac, telemetry, med-surg units, as well as a couple area skilled facilities as their MDS coordinator. Rachel began her career at McFarland Clinic 21 years ago as a primary nurse for a family practice doctor. She worked with him for 19 years, and then she transitioned to the population health department 2 years ago as chronic care manager before becoming the manager of the department just over 1 year ago. Rachel is married to her husband, Randy, of 28 years, lives in Gilbert, and has 2 children. Seth is a first lieutenant in the United States Air Force, and Sadie is a rising senior at Gilbert High School. Her hobbies include traveling, going to air shows, attending and being involved in her kids' various activities from scouting to sports and anything in between. Please welcome Rachel.
Thank you, Vicki. As she mentioned, I'm the manager of Population Health Management Department at McFarland Clinic. Our agenda today is to introduce to you who is Population Health. It's a newer department. Also, the Medicare Wellness Physical. Is it my physical? We'll go over questions regarding that. The Health Risk Assessment Overview. What can I do to help prepare for my wellness visit? And then answer any questions, as Vicki said, at the end. McFarland Clinic Population Health. We are a newer department within McFarland Clinic, and I have listed the 4 areas of which we focus our staff on. We have a care navigator, and she helps with patients find primary care providers, which can be kind of difficult at times due to providers leaving, new providers coming. The time there can be a wait. She also sends out reminders for annual wellness visits as well as physicals. And I will come back to the annual wellness visit staff. I have 4 of those. I also have 12 chronic care managers that I supervise that are within each of the primary care departments of McFarland Clinic. They call on patients with Medicare or Medicare Advantage plans and have 2 chronic diagnoses that may be needing a little additional accountability for their care monthly. And then we have 2 people that we have what we call HCC coders. It's a fancy term to use for the coding that the providers use. And they help them get the diagnosis codes that they're most complete and specific to make sure that the codes match what they're seeing with the patient. Well, okay, that's nice, but what do we actually do? Well, we'll focus on the area. We actually work with the Medicare population, help prevent unnecessary hospitalizations, ER visits, and help manage those chronic illnesses. We also help most of the primary care departments within McFarland with their annual wellness visit. And that's who we'll focus on today. The annual wellness staff goes through the annual wellness visit questions, otherwise known as the health risk assessment, and prepare the chart for the provider. This will also save you time during your visit. Medicare wellness. Well, isn't it the same as a physical? Not quite. It is more of a conversation of wellness and prevention. There are 3 types of Medicare wellness visits. There are 3 different types of Medicare wellness. There's the Welcome to Medicare, which is administered during the first 12 months of Medicare Part B benefits going into effect. So some of you may be on Medicare because you are age 65, but you may be still working, you have Part A benefits, but you don't have the Part B benefits yet. So it's the Part B benefits that will go into effect. Part A is for hospitalization. Usually, Part B is the clinic outpatient side of things. There is also the initial wellness visit, which happens during the first 12 months of those Part B benefits going into effect. And then there is a subsequent wellness. So there, even if you have not gotten so let me back up. Welcome to Medicare happens within the first 12 months of the Part B. Initial will happen starting month 13, and then subsequent wellness will happen after that. You do not have to have a welcome to have an initial or subsequent. It's just that's the timing of when the benefits go into effect is how we, on the clinic side, clarify it. Also, you no longer have to wait 366 days now to get your Medicare wellness exam. It can be 1 year. For example, if you had a Medicare wellness visit on, say, May 24th, 2023, you can now get your next Medicare wellness exam on May 1st, 2024. So before, several years ago, you had to wait 366 days or 1 year plus 1 day. You no longer have to do that. It just can be within the same calendar month. That is more for the traditional Medicare. So if you just have Medicare B, the red, white, and blue card, plus a supplement. If you have a Medicare Advantage plan, so like Aetna, AARP, United Healthcare, Wellmark Blue Cross, check with them because you can do it maybe in a calendar year, but most of the insurance plans generally follow Medicare B guidelines in regards to your frequency. However, you may be able to get a physical also with a Medicare Advantage. So check with if you have a Medicare Advantage plan, please check with that. As I said, it is a covered visit by Medicare. It is free of charge for those of you who have Medicare. And it is more of a conversation. It is not actual hands-on physical. We'll go into that. Unlike a physical exam, a wellness exam focuses more on the prevention of diseases and disabilities. It's not about the blood test or listening to your heart and lungs. It's more of the conversation that you have to help prevent any further illness. You can expect questions about your current health history and your health status. And like I said, let's see, the AWV, or annual wellness visit, as we refer to it now, is free for all Medicare patients. So that's why it's not a physical. If your doctor does or provider does do a physical, they will bill it as separately. So you may notice a separate charge on your EOB or explanation of benefits as some other exam happening, but your Medicare wellness visit will be covered by Medicare. As the other ones that will be diagnosed. And usually they're coded towards like if you have, say, diabetes and congestive heart failure, it will go along those lines. It'll be coded to those. So, and there are no deductibles or co-payments for a Medicare wellness exam. So, your provider is not the only one that's asking the questions in this. And there is no silly question at the doctor's office. The annual wellness visit is about you and what you can do to stay healthy. Be honest about your concerns, including conditions that may run in your family, your health history, because there's certain diseases that do have a genetic or family history line to it. And that's also how you can get a more personalized advice from your provider, is be open and honest with everything. As you get older, your body reacts differently to medications. Bring a list of your medications. And speak up if they make you dizzy, drowsy, irritated, any side effects you may have. Constipation or diarrhea are very common with most medications. Also, after age 65, men and women may need to be screened for colon cancer, prostate cancer, breast, and breast cancer. A lot of those screenings do happen earlier. We're getting more people screening for colon cancer starting at age 45, breast cancer age 40 or earlier if there's a family history. You discuss these with your provider, and they may refer you to special testing based on what information you provide for them. Also, after age 65, consider being tested for osteoporosis, and also keep up with your vaccines. With getting older, especially in women, estrogen helps keep the bones healthy. We lose estrogen as you get older, and so the bones become brittle, and what we call the holy bones is that they have a lot of spaces, high risk for falls, fractures, and pain with those fractures too. Keep up with your vaccines. The CDC has recommendations for specific vaccines for your age group. Talk with your provider about which vaccines suit your age or your health history. Pneumonia vaccine, shingles vaccine, and I'll show slides later about which vaccines may be more relevant to you. Also, contrary to popular belief, older adults can prevent many common health issues by making that annual trip to the doctor's office as part of your golden years routine. You're not too old to help prevent diseases. The health risk assessment. I have a copy of it that we use. It's a list of 34 questions that we have at McFarland. It is used during the initial and subsequent Medicare wellness exam. It is not used during the welcome exam. That is a completely different set of questions and things that the provider does within the office. The set of questions is either mailed to you via snail mail or the post office, or if you are MyChart active, it is sent to you via MyChart. And you can answer those questions in MyChart. One of my staff members then will call you a couple days prior to your wellness exam and help you complete the questions. And then they'll prepare that chart for the provider for your annual wellness visit. If your primary care department is located at Family Medicine East, Story City, Adult Medicine, or Nevada, they use a tablet or an iPad that will go through those same questions as well. And it gets loaded up into your chart. The wellness exam is loaded in 3 sections. Cognitive functional status, which has risk factors including psychosocial and behavior health, as well as safety. We have social risk factors and the behavior risk factors such as tobacco, alcohol use, motor vehicle safety, home safety. We included all of these 3 sections what we call social determinants of health. This would be able to includes, can you afford your medication? Do you have adequate housing? Are you able to get enough food? Can you get to the grocery store okay? Can you get to your doctor's office or back home again? How about from the hospital? If you get admitted from the doctor's office to the hospital, do you have somebody who can pick you up? Or do you have family or friends around? Those are some things that we look at through this and help make our providers aware. The nurses will also review and update the most recent health history. And there are questions that generally the primary care provider doesn't have time to ask, which is why my staff goes through them. And that way it saves, like I said, it saves you time during your wellness visit. They update your chart with most recent risks, medications. So if you've had a change in medications since the last time you saw your provider, say you see 3 specialists as well as your primary provider, and they want to make sure that everything is correct in your chart, including your medications. Like if you see a cardiologist, endocrinologist, neurologist, all those medications should be up to date. It helps your primary care provider who's overseeing your care be up to date with your health. All right. Now on to those questions. Like I said, I have available the health risk assessment. As you go through the questions, you may notice that there are similar questions in different areas of those questions. There's a little bit of logic behind that. It's how my staff will go through and answer these questions in order to get it prepared. So it may seem a little redundant, but there's a reason for it. So it can help them quickly prepare the chart, in other words. One area of focus is cognitive and functional status. Questions related to your hearing. How well can you make decisions? How well can you concentrate? Can you climb stairs? Do you have difficulty walking? Can you walk more than 200 feet? Do you have grab bars in your bathroom? Do you have trip rugs? Or I call them trip rugs, but throw rugs that can be a very trip hazard. How well can you do your activities of daily living, or ADLs as we call them in the nursing world? Washing, bathing, eating, combing your hair. How well are you able to do that? How easy are you able to get to your appointments, run your errands, do shopping? Do you always have somebody go in there? Do you have to have home health in there? Those are some things that we kind of look for. Social risk factors. These include the ability to read and understand the information we just presented to you. Do you understand it? If not, we'll help you maybe rephrase it in a way that you can understand. Social determinants of health, or as we've also recently heard, social drivers of health, which includes the affordable housing, medication, food insecurity, transportation. And why do you think your provider might need to know these? An example. Let's go back 6 years ago to July of 2018. What happened in our state? In 2018, there was a large tornado outbreak. An EF3 tornado hit Marshalltown. It destroyed many homes and businesses. Well, one of my staff happened to call one of her patients 1 year later, just prior to her wellness visit. So this is a couple days of this. A couple days prior to it. Let me go back. I went through a lot of slides here.
Right click and go to everything.
There I am. I went through too many slides. Sorry about that. So 1 year later, 2019, a patient is still waiting to hear back from her insurance and get repairs on her house. So her house is kind of in disrepair right now. And this is 1 year after that EF3 tornado hit Marshalltown. Well, then 2 years later, here comes a derecho. Hits the same area again. So you can imagine what this patient might be feeling like after a tornado and a derecho come through the same area of town. I mean, that's why we check to make sure, do you have adequate housing? Do you have sufficient food? There's natural things we can't control that may happen. How can you prevent disability and illness if you don't have a roof over your head? Basically, it's kind of what I say. Transportation. Can you easily get to the lab or to the doctor's office for testing? For example, did you notice a lump in your breast recently? Can you get to the doctor's office to get it checked out, or to radiology to get a mammogram? Is public transportation an option? Here in Ames, we're kind of blessed. We have SciRide that goes to most places. Herta Bus is available also in Story County. But if you live in a more rural area, how can you get there? Do you have friends, neighbors, church members? What is available? There's also a group called RSVP that you can call ahead of time to possibly reserve a ride. Uber now is starting a medical Uber. However, that can be expensive. Not everybody has that. So those are some things we want to check about. Certain insurance companies also have a benefit for transportation. Mainly patients that have Medicaid as well. They have a certain allowance for transportation, but also some of the Medicare Advantage plans. So maybe if you have a Medicare Advantage plan, you might want to check to see if you have a transportation option on there. Do you have a good connection with your family and friends? It's found that those with good connections generally live a healthier life, as it can reduce stress, which can lead to health problems. Safety, your own personal safety, safety within your home, or with other people in your life. Is your children safe? Do you have a lot of trip hazards, like I mentioned earlier? Are you okay living with your spouse, or is there something else going on? Advanced directives, I'll explain this on the next slide, but advanced directives, power of attorney, and living will are also, we touch on that. Advanced directives, it's easy to get confused as to what it is between advanced directives, power of attorney, and the living will. Here's just kind of a simplified explanation of them. Advanced directives refer to any legal form that's guiding the future of your medical care. Your living will refers to specific documents that shape your end-of-life treatment. Do you want to be resuscitated? Do you want to be put on a ventilator? Do you want to have life-saving treatment? Continue on. So that's more the end-of-life type of stuff. Power of attorney empowers a certain person or designated person or persons to carry out your living will, advanced directives. So it's kind of a simplified version. We do have copies of it at McFarland. It can also be found on our website. So all the primary care offices should have a copy of what we call it the McFarland Directive or medical directive, and it has all three of those in there. Some of them need to be notarized and witnessed, but it is all in one spot. And there's a link on the website that you can go to get it. And it's underneath patient resources, medical records, and legal documents. There's also a form called the iPost. Some of you may have this. It is very similar, but it's something that your doctor signs, and you can just place it on the refrigerator. So if something should happen and EMS needs to be called, they know what to do. They'll have a point of contact on there, or here's my conditions and such on there. So something for you to see and something for EMS to see as well. Behavioral risks. This section includes questions that pertain to substance abuse, such as tobacco, alcohol, marijuana, vaping, and other recreational drugs. They will help determine in your conversation as to if there's any further lab testing or imaging that may need to take place. Certain medications will also be affected by the use of these substances. Motor vehicle law, also in there is motor vehicle safety. Iowa law requires passengers in the front seat to be belted at all times when the vehicle is moving. Do you require seatbelts for all your passengers if you're the driver? If you're not driving, are you buckled in as a passenger regardless of where you are seated? There's nothing worse than being ejected from a motor vehicle during an accident. It's not fun to see. Home safety. This includes smoke detectors. Do you have them? When was the last time you changed the batteries? Also, along with that, carbon monoxide, the silent killer. Do you have detectors for that? Do you have batteries that need to be changed for that as well? Living in Iowa, most of us have a furnace that operates off natural gas or a gas stove. If there's any issues with these appliances, you run the risk of having increased carbon monoxide buildup in your home. If you have unexplained headaches, dizziness, lethargy, those are some of the symptoms of high carbon monoxide levels. And for about $20 or less, you can get a combination of a carbon monoxide and a smoke detector at Walmart, Ace Hardware, hardware stores, maybe even Hy-Vee. Also included in the home safety are hazards such as the throw rugs, cords, extension cords. Those can be a high priority, especially if you don't have air conditioning and you like running your little box fan around. It can be a major fall risk. Slippery bathtubs, slippery showers. Do you have grab bars in your showers? Do you have strips in the bottom of your tub that kind of help prevent slipping? Many tubs these days do come with the anti-slip stuff, but some older homes do not. If you have rugs on your floor, do they have the gripper underneath to help them prevent from sliding, especially on linoleum? Are your steps well marked? Are they well lit? I've been in a couple homes where they would put reflective tape on each of the steps so they knew where the steps were. Some people also put gripping stuff on the risers so that their feet won't slip, especially if they don't have a carpeted stairwell. Is it well lit? Are there areas of your home that you frequently go to? Are they well lit? Sorry. Your health risk assessment also includes recent hospitalizations. Most of the McFarland providers do get notification of this, especially with the advancement of our electronic health record, or EHR. We get notification and can see records from, for instance, Unity Point in Des Moines. Most of the hospitals around we do get notification of. We share an electronic record with Mary Greeley. So since all the providers in the McFarland, at least in Ames, have privileges at Mary Greeley, they share the record back and forth. In fact, we went up on the EHR together. We get notification through Care Everywhere of, like, for instance, if you went to Nevada to the hospital, Story County Medical Center, we get those notifications. There's a Unity Point, I mentioned Unity Point in Des Moines. They have the Epic system, or the same type of EHR that we do. The records come into our chart as a notification that somebody was admitted. But it's always good to notify your provider if you've been hospitalized since the last time you saw them. Because we also need to coordinate care with specialists as well as our provider, or just other providers. Your surgical family history be updated. And I think, well, why is that important if they can already see it? Take, for example, you went to, say, Mexico on vacation. You fell and broke your ankle. It was severe enough to have surgery in Mexico. I had my sister, who is also a nurse, had this happen to her neighbor. And she actually fell and broke both ankles, had to have surgery in Mexico, and then requested her records. She brought her records back home with her, and she had to update her provider as to everything that happened. And you just bring the stack of however many days she was there, medical records, with her to get the most needed care. And ended up needing home care, wound care, just general cares and help. So this is why it's important. Even though we can see, we don't always get all the records. About a year and a half ago, Mercy One had a huge data breach. And Mercy is a major hospital system in the Des Moines area where a lot of trauma happens. A lot of heart patients go there because that's their level 4 trauma center, and they have a lot of good cardiologists that do open heart surgery. Since then, we have been having issues trying to get discharge reports from Mercy One without really having to fight tooth and nail to get reports. And sometimes we don't find out until days or weeks after somebody has been discharged from the hospital. That's why it's important when you go to the hospital, get discharged, notify your provider. That way they're most up to date. It provides a timeline as to how your health is. Along with that, we also ask if you've fallen within the past year. And if so, how many falls have you had? Okay, do we need to have you see an optometrist? Is your vision bad? Are you having something neurological happen? Do we have a need you see a specialist? These are some things that, you have that conversation of, is like why we ask some of these questions. May seem kind of silly when you're going through the questions with the nurses, but there's a reason. We want you to have the most up-to-date care as possible. Well, what else can I expect from my Medicare wellness? Once the questions are answered, the nurse will review any questions that the provider will need to be alerted to. You'll be asked about your current medications and allergies. It's very important, especially if you, like I said before, if you see specialists, that we have the current medication, because medications that your primary care provider may interact with medications that your specialist provided. And also helps with dietary guidelines. For instance, if you are on warfarin, we don't want you eating spinach. If you're on amlodipine, a blood pressure medication, really don't want you having a grapefruit for breakfast every morning. Those are types of things that do interact with certain medications. It helps reduce the errors, and ensure also that you get refills in a timely manner, especially if you're on long-term medication like your blood pressure medications, your warfarin, etc. Your fall risk assessment, again, will be assessed. Your family history, surgical history is updated. And the family history is usually done the first time that you see a provider or a department. But any updates are greatly appreciated. For instance, if you recently had, for females, your mother was recently diagnosed, or your daughter was recently diagnosed with breast cancer or ovarian cancer. Those are the kinds of updates that we want to hear, because there may be certain testing related to that family history. Immunizations. We want to make sure that you've had any immunizations. They are reconciled with the state registry. We have a flow. If we give a immunization, it goes to state registry. If Hy-Vee gives you a flu shot, it goes to state registry. We reconcile it, or we get it up to date, and that way we won't give you a flu shot twice if you just got it from Hy-Vee. We can see that you got it at Hy-Vee. Is there more you can expect? This is a list of common vaccines often given to older adults. Shingrix, or the shingles vaccine, is most covered best at the pharmacy, but also depending on your insurance plan. Sometimes they'll pay it at the doctor's office, but most often better at the pharmacy. Other RSV is a new one that just recently came out for older adults. We did some extensive testing here with Accelicare, one of our partners that we have. They did some trials with RSV patients. TD, Tdap. Medicare usually does not cover this vaccine unless you have had an injury, a puncture, a scrape. It's just one of those things Medicare doesn't, even though it's recommended, like if you had new grandchildren, great-grandchildren, they recommend that be up to date on your tetanus. It's also just a good thing to be up to date on it. It's usually less than $50, maybe even 30. I'm not sure the exact pricing right now, but it's fairly inexpensive and it lasts for 10 years. Influenza, that's annually. And pretty soon here, starting in August, we'll probably be starting to see fuel savers for Hy-Vee for your influenza vaccine, or anything. But starting August, September, early fall, the provider's office generally will start having the flu vaccine available for you. Those are just the common ones. And like I said, the Shingrix, check with your insurance company as to where it's best paid. Also, other preventive ancillary tests that might be discussed. If you do the Welcome to Medicare, the ECG or electrocardiogram is done, as well as an abdominal ultrasound, especially if you're a smoker. They do that to check for what they call a AAA, or abdominal aortic aneurysm, which is can be found in smokers, especially long-term smokers. A CT scan of your lungs is sometimes ordered as a screening test for smokers, regardless of how many years you smoked. It's just to get a baseline as to whether or not those nodules start appearing or if you are at risk for developing lung cancer. We may screen for diabetes, do a A1C or a fasting blood glucose, just to see if you're at risk. Many older adults are at risk for developing type 2 diabetes. This is not the diabetes where you always have to give yourself an insulin shot, your pancreas just quit working. This is the diabetes that is generally with overweight, obese, older people. Your pancreas does need a little help. That's the organ that secretes insulin that helps you keep your blood sugars under control. But it doesn't quit working, it just is not functioning as well. So it needs a little help. So they may do a test on it based on that result. If it's high, they may try working with you in diet, exercise. If it's overweight that's causing the problem, if it's high enough, they may start you on medication to help with diabetes, and they call you type 2 diabetic or non-insulin dependent diabetes. Labs also may include cholesterol, which is a fasting medication. And if you're not fasting at the time of your Medicare wellness exam, don't worry. They'll schedule a lab for another time when you can be fasting. So your annual wellness does not have to be at 8 o'clock in the morning. It can be at 2 o'clock in the afternoon. Lab's very flexible. Unless you're a person that likes to fast all day, go for it. Your PSA for men, to check for prostate cancer. Blood chemistries, check your electrolytes. Medications that you may be on can affect your electrolytes. If you're on a water pill or a diuretic, your potassium level, if you're not on supplemental potassium, can go down really quickly, and that can cause a lot of heart problems. Or other can keep your potassium level up, also cause heart problems. And your blood count, your CBC. It'll check your white count, which will check for infection. It'll check also to see how your hemoglobin is, if you're anemic, if you're in need of blood. And other abnormalities that may detect some sorts of blood cancer, like leukemia or something along that line. For females, schedule a mammogram, annual checkup. Bone density scan, this is what helps screen for osteoporosis, both for men and women. Higher likely of women, but percentage get checked. But men also are at risk too, as well. Become more sedentary, not as weight-bearing. Those are risks for developing osteoporosis. But like I said, your provider will discuss these with you. Well, what else can you do as a patient? At a minimum, we request that you bring a list of your current medications. It would be a good time to also bring all of your medications. I've seen people bring them in plastic tubs, shoe boxes. They bring their medications, old or new. I have seen expired medications, but they didn't want to get rid of them. This is so that at your visit, the rooming nurse can go through and make sure that what you are taking is what is on your medication list and what we have in your record. And that will help prevent errors and help reduce some complications. Also bring your herbals, vitamins, supplements, that calcium, black cohosh, you name, you name it. If you take it as a supplement, bring it. The providers would rather have you bring them than to have an error happen and complications. One of the providers in adult medicine does actually require all her patients to bring them in. So, also, I talked about you need to come prepared. bring your medications over the counters. You might not necessarily need to bring all the bottles of Tylenol or ibuprofen that you take, but at least have a list that you do take those medications. Have a list of questions that you may want to ask your provider or concerns that you may have. Hey, doc, this med is not making me feel, it makes me feel lousy. I feel really tired taking it. What can I do? Or, I've had this pain in my hip for 3 months now. I can't seem to get rid of it no matter what I do. What's going on? Or, my finger feels numb when I put my hand down on the thing right here, on the table. It goes numb. This has been going on for 3 weeks. They may, depending on the time, they may only limit you to about top 3 questions that you may have. Some people have a tendency to come in only once a year to the provider and have a laundry list of questions, and they can't get through them all. They may only limit to the top 3 or 4, and they may schedule to come back for another appointment to address those other concerns, especially if the time doesn't allow, because they want to spend the time with you, but they also have probably 4 or 5 other patients scheduled for that morning too, behind you or ahead of you. So just to be kind of cognizant of time too. Not that they have to rush through it. They will take the time, but they may also limit you to a number of questions. What was that? Okay, sorry. Here's the contacts for AWV staff. Like I said, we are all in all primary care departments except for Family Medicine East, Nevada, Story City, and Adult Medicine. Those are the 4 primary care departments that we do not have an AWV staff to go through those annual wellness questions with you. But those are their contact numbers. But yeah, I have 4 staff that do this throughout the time. Just a reminder, it's not a physical, it's a conversation. It's not required, but in order to prevent further illness and to keep healthy, and it's a good way to do it annually, and also just to keep your health record up to date. All right. Do we have any questions? I will put my contact number information up here.
All right, I'm going to make my way up here.
Thank you. You did a really nice job talking about the annual wellness visit. Thank you. But as a recent switch over from private pay to Medicare, I'm still confused. When I call to see my doctor for my annual visit that I used to call a physical, have we just switched names? Is there still such a thing for a Medicare patient to get a physical? The one I remembered having when I was 64 years old rather than 65 years old.
Yes and no. It depends on if you are Medicare Advantage. Medicare Advantage will pay for a physical if you have Medicare Advantage plan. If you are what we call traditional Medicare, Medicare B, they will kind of do a physical, but they'll bill it separately. I mean, they can do it. It's just you may also have a copay or coinsurance with that, because they'll bill it to if you have a chronic disease, for instance, if you have diabetes, congestive heart failure, high cholesterol. So they will still do it. It's just they have to do it separately. The annual wellness is more, or welcome to Medicare, more conversation and prevention. So you can still have it. I mean, I've been in the office and we've had 85-year-olds in there doing a physical, head to toe.
So when I call to the receptionist, then I just say use some generic term. I want my yearly, and they'll figure it out.
They'll figure it out generally.
Whether you call it a AWV or a physical. Mm-hmm. But they now, those terms are kind of shifted.
Yeah, they've shifted. The physical is a physical, the hands-on, heart, lung, listen, head to toe.
Yeah.
Whereas the annual wellness visit is more the conversation of prevention. So that's kind of the big difference between it.
And is there a copay with the annual wellness visit?
No.
That is free.
That
for
is free of charge to Medicare. Medicare covers the
Medicare, yes.
annual wellness visit. If you have Medicare Advantage, it may also cover a physical. But
My question is, if I have a primary care doctor I've been getting my physical through, and I turn 65 and I want a Medicare physical, and my doctor doesn't do them, some doctors do not do Medicare physicals, do we contact your office and they will line us up with a different primary care doctor?
I haven't heard, I have heard of some not doing the Welcome to Medicare physical, but in terms of a Medicare wellness, all of the providers in McFarland do wellness exams. They should be doing wellness exams.
Okay, so then I'm not sure if this is exactly what you're asking, but it got me thinking of a question. I know sometimes we hear, oh, they won't take Medicare patients. Do we have that restriction?
Yeah.
Okay, I was going to say because, and it's just something you kind of hear that can happen some places. I didn't think I heard it here, but I'm assuming once you're established with a physician, even as we age and we become Medicare age, you can stay with that physician, right?
Correct.
Okay.
The only thing would be like pediatrics.
Right, exactly.
All the family medicine providers, adult medicine providers that I know of do Medicare wellness
Okay.
exams.
Good. Tim, are there any questions online?
Nope, no questions online.
Okay, when we go in for our Medicare wellness physical, and let's say we've gone through the questionnaire and we are having trouble ambulating or stairs, and so the physician says, well, I'll, send you to physical therapy. So then you get billed for the office visit.
You shouldn't get billed for the wellness exam.
Right, we get billed for the wellness exam at no pay, and then we also get billed for office visit for the problem that we brought up from the questionnaire.
Unless they did some further exam, that one you may have to do as a specific case-by-case thing, but generally, just to refer you to physical therapy because you have a problem with falls or weakness, that should fall under the Medicare wellness exam.
So that brings up a good question. If somebody has a question about how they are billed for these, who do they reach out to?
I would reach out to our billing department has, and I don't have their contact in here, but McFarland on their website has a billing department that they have a customer service number that you can call. And it may come to a phone tree. It's like, if you have a question regarding your bill, press this number. If you have a question regarding such and else, press this number. So,
I have two questions. I had what they called a wellness physical 2 weeks ago, and I answered before I went in this questionnaire. Mm-hmm. Okay. When did this start, this wellness, Medicare wellness, as you're talking about today? And then I filled out the questionnaire, and you referred several times someone, a staff person on your staff, would call or talk to me about this. Mm-hmm. I received no call.
you did not. Okay.
No. Does your regular doctor do this Medicare wellness checkup?
Yes. So to answer your first one, we started this, I would say it's been 12 years. I remember they used to do it in the office with a paper form. I remember going through a 6-page paper form with my patients as they were roomed when I worked for my primary doc. Probably within the past 6 or more years, it's been either a tablet or it's been online. Maybe it's been even sooner than that, but definitely within the past 4 years has my staff been doing it. If by chance my staff does not get a hold of you prior to your physical or your wellness exam, bring that questionnaire into the doctor's office, and they can pull up the questionnaire in the chart and go through, just put your answers in there. They can do that too. So if by chance you did not get a phone call from my staff,
And they would have received that before the wellness visit.
correct. Correct. If you scheduled it and it was within like 2 days, the next 2 days, so like if you scheduled it for, like today, if you scheduled it for Monday, they may not have had a chance to do that. But they try to get most everybody called within 1 to 2 days prior to their visit. Even on the morning of, you can call. They may have left you a message. That's a good point to make sure that your contact information is up to date in the medical records so they can call too. Does that answer your question?
Been doing this for about 6 years.
My staff, there's been.
How long have they been offering annual wellness visits? I think that's
Is that what you
maybe-
want? How long? I would say at least 12 years. I can do it that way in some form. My staff probably hasn't been in place since probably more like COVID. They've really started having 4 staff call, one of my 4 nurses call.
Because I don't know that everybody has always had the awareness that this was a benefit of Medicare. So, right.
Yeah. So,
And how often do you get an opportunity to sit down and just talk to your physician? So take advantage of it.
Could you tell me what a RSV vaccination is and if it's important for every single person that's older to have it?
the respiratory syncytial virus, generally you heard about in kids, like the babies. Generally is one that RSV is a common illness, a respiratory illness in babies. If you RSV, they generally recommend it, for instance, especially if you're a smoker or have a history of smoking, have any other disability or condition that may cause you at risk for getting infections. That's a conversation to have with your provider as to exactly if you are at risk specifically. They may recommend, it's a newer vaccine. I know like last fall, I think is when they first started with that one. After Accellacare, our research thing did trials.
Am I right when anybody can get RSV, right? It's just the infants that have such a hard time with it, and that you said then if you're going to be around small children, especially is when they recommend it? Or
That one, and also Tdap, the tetanus vaccine. The Tdap was the one, pertussis was the vaccine in that part. That's the Tdap is pertussis, which is a respiratory illness that they can have.
So my doctor still has the paper assessment done as I'm sitting in the waiting room to go in. Does that still come to you?
It comes to they generally will fax it to, let's see, your adult med by chance. Yeah, they will generally put that in themselves and go through it. My staff has not branched out to adult med because there's been kind of resistance there. It's adult med. And so there's a number of providers up there that need to kind of be on board with it, and they do it themselves or have their nurse do it.
Yes. It's my understanding that at age 80, once we reach 80, no longer are colon screenings done. Is there a reason for that? I have 3 friends who just recently were having some trouble, and then so they were checked out and so forth, and they all 3 have cancer throughout their body, starting there. Yes, and they're over 80.
Yeah.
Well, one's only 83.
Yeah, generally the screening colonoscopy is only covered up through 80, up through before 80, 79, 80. That's the screening one. It's done once every 10 years. However, if you notice a change in your bowels, any blood or abnormality that's just not right, have it checked out because they can do a diagnostic colonoscopy or a test. If you can't stand the colonoscopy, they can do a CT colonography to check to see if you are at risk for, if there's something abnormal there.
Usually too late.
Granted, yeah.
I think it's a quick one. I was told that Medicare didn't cover the tetanus unless you got a wound. And then I think I was told then they did cover it, or maybe I was told just go in if you get a cut or something and tell them you
Right.
need a tetanus.
Yeah, the tetanus exam is not covered by Medicare. It's one we fought for in primary care, unless you have had a wound, a puncture, scrape, something along those lines. Usually after 6 years, that wanes. It's good for 10. Then we check if you go in and have like any one of the puncture or injury or something like that. We check to see if it's been within the past, you've had one within the past 6 years or so at least, because the efficacy kind of wanes after 6 years.
Any other questions? Aha.
Hi, I'm still confused about wellness and physical because I've gone in for physicals. I've never gone in for a wellness anything. And I've been back in Ames for like 12 years. So I've gotten missed on this thing and on this form I've never seen before either. So I'm confused. Do I ask for a physical a year from when I had my last one? Or do I ask for a wellness? Or do I ask for wellness now and a physical a year from when I had the last one? Or what happened?
Good question. And it is, I can understand your confusion. It is it can be very confusing. If you I would ask for a wellness. If you're at one of the clinics that has the iPad or tablet, they ask you to fill out all these questions. They don't? Okay. That's the same. I would ask, and you're on Medicare, you may want to ask for a wellness exam so you can have the conversation, or you can say a wellness physical, and they may do both at the same time, depending on your provider.
And make sure you say Medicare annual wellness visit. But this is my question. It's not up to your doctor to reach out and say, hey, you need to schedule an annual wellness visit, right? This is on us. So if we haven't asked for it, they're probably not going to say anything or to schedule it, right?
Right.
Right. So it sounds to me like within a year, you could have both an annual wellness visit and a different time have a physical, right?
If you are at Medicare Advantage. If you are traditional Medicare, just the red, white, and blue
Yeah.
card, they won't cover a physical.
Okay. So you'll go in for an annual wellness visit. Okay.
Depends on your supplemental. If your supplemental if you have a supplemental, check with your supplemental and see if they will cover. Sometimes they'll pick up like a coinsurance or copay for it.
Not if Medicare will pay.
Medicare itself won't pay. So if you're on Medicare,
They don't pay, then your supplemental.
okay.
I think that some of these, the annual wellness risk assessment that you have on paper actually gets sent out a week or so before your visit to the doctor on an email or whatever, and it just says, check in. And they seem to ask these very same questions. And so then I go down, when I show up at they say, oh, you've already checked in, just go right upstairs. If I haven't checked in, then they'll hand the clipboard. And so I think maybe that's where some of the confusion might be, that I don't actually get a phone call. Sometimes I do, just a reminder. I got one yesterday saying, oh, next week I have a scheduled appointment. Mm-hmm. And again, with my doctor, before I even leave, they schedule the next scheduled appointment, and it's probably a 3-month wellness check, and where they're not taking your blood pressure, and well, they always do that, but, listen to the heart and all this kind of stuff, which is the annual, one of the 4 physicals. Does that help you?
Yeah, that can cause confusion. If you have my chart, there'll be a separate one. It'll be sent by a nurse, a separate message sent by a nurse. And it will have you review those questions through there. And you may have back and forth my chart message conversation with them, or they may pick up the phone and call you. But the check-in part comes from our appointments, our schedules, our registration portion. So it's a different part of our electronic health record that has you check in ahead of time, like a week ahead of time. Answer if you've flown, communicable disease, how you feeling? Short, simple questions. Here's your insurance. Is this correct? Those are some of the ones that for the check-in portion of it, but the other.
Okay, so I'm guessing everyone in here except me is Medicare age. So I have got to tell you, I'm definitely blown away that Medicare doesn't pay for an annual physical. I had no clue until right now, especially like when I think of Mary Greeley. They went to, if we have their insurance, probably 10 years ago, we are required to get a physical every year. And if we don't, our portion of what we pay for insurance is more because we didn't get that physical. I mean, you want to catch those things. So I can tell you my mind is blown right now. Very surprising to me.
So I'm going to try to summarize this from my perception. My perception is that Medicare operates the way we used to, where you just went to the doctor when you had something that was bothering you. And then private insurance came along with our employers, and they started this concept of the annual physical. And we all got started with the annual physical, and now we all think that that's just how things work. And so Medicare hasn't adopted that annual physical coverage yet, or maybe ever. And then, though we've seen that people can benefit from having all these preventative care, and so Medicare is now adapting to that, it sounds like, by checking to see that people have vaccinations and checking to see that they're going to be okay in their home and all that. But they're still not paying for the things that we have become accustomed to through our private insurer by having these blood tests every year and so forth.
Yeah.
Which is a good reminder, because if you are a current Primetime Alive member, you can get a Primetime Alive wellness screening through our lab. It's $40, but that is a greatly reduced price. That includes many different lab tests in there. And because you're a Primetime Alive member, we don't normally, if you do walk-in wellness testing, we do not send the results to your physician, but for Primetime Alive members, we will. So that's something to keep in mind. You know, if you're due for some lab work or you want some, you know, on an annual basis to check some of your different numbers, you can use your Primetime Alive benefit through our lab here. So, all right. Any other questions? Wow, lots of good discussion today on a topic that I know, talking about insurance in general and then Medicare on top of that, I know can be very confusing. So as you can see, you've got a great resource right here, everybody. If you continue to have questions, you've got a phone number you can call, somebody who can help you out and answer those questions, because, you know, the Medicare rules are probably in a book if they printed this thick, and we can't expect for us to know that. So it's nice for us to have these resources. So Rachel, thank you very much. Yes, please give her a round of applause. And I want to remind everyone to please fill out your evaluations, give us ideas for other programs or presenters you would like to hear from. Next week, you should get your flyer with your July through September programs, including the September day trip. But I'll give you a little highlight. Our next program, we have a little bit of a break here, is Thursday, July 11th, 2 p.m. here in Bessie Myers Auditorium. It's on senior living options. Which one is right for you? So once again, thank you for joining us, everyone. Thank you, Rachel, and have a great day.
I do have business cards up at the top, if you guys want those too.